Hi, everyone. Thank you so much for joining us tonight. We are going to hear from a powerhouse group of special education parents, teachers, and advocates who are pushing for more funding for special needs students. So tonight we're going to discuss what is needed for special education and how our lawmakers can fix the funding crisis in our state and how you can support this critical push. So thank you so much for joining us. If you're watching us live, you can type questions in the chat, and we should have some time at the end to make sure to answer a few questions. My name is Beth Lewis. I'm one of the co-founders of Save Our Schools Arizona, and we're so honored to share our platform with these amazing parents and teachers. So let's see, Amanda, would you like to introduce yourself?
Absolutely. I am Amanda Steele. I am a parent in the Tempe Union High School District. I'm an advocate for the community. I have had a son in the public school system his entire educational career. And as I've educated myself along the way, I have discovered that there are many faults in the education system and everything leads back to funding. So I have made myself an advocate for publication to provide services that are needed for all people with disabilities.
Thank you for being here, Amanda, and thank you for advocating. Michelle, would you like to introduce yourself?
Sure. Hi, everybody. My name is Michelle Moulton Thorne. I am the executive director of Dames Charities, Inc., and I'm the mother of 2 children who have been diagnosed with autism. I sit on a lot of boards that are associated with DVD, Altex, and the Interagency Coordinating Council Financial Committee. And we are just really coming to grips with how underfunded the systems are. And so I am a huge supporter of early intervention and all of the great things that they do for our children. And so I'm here today to just make a big push to actually get it fully funded because we need it.
Thank you, Michelle. And Raquel.
Hi, everybody. My name is Raquel Mamani. I am a mom of 7th grade twins that are in the Madison School District. And I am a teacher. Currently, I substitute teach in the district. And I'm also a former special education teacher. So I've been an advocate, became an advocate just as a parent, going down to the legislature and learning about what was going on. And have been advocating ever since, learning the information because we need to get people to understand what's going on. And I also have a son who receives special education services for severe learning disabilities. And so as a former special ed teacher and a current mom of someone who receives services and someone who just loves our public education system, I'm here to advocate and to join whomever I can to make this push.
Excellent. Thank you, ladies, for being here. So I'm just going to jump right into some of our questions. So special education funding obviously is extremely complex and incredibly important. Amanda, do you think you could start us off by explaining how the funding works and how funding cuts have impacted our kids and their services in our schools?
Absolutely. So every school gets a flat amount of money per student. In order to figure out special education, the funding is done in weights based on the diagnosis categories. The weighted amounts can be found at the Arizona Department of Education's website. Some students, like those with autism, intellectual disability, or a visual impairment, to name a few, provide the districts with a higher add-on weight. For example, a student with autism that is mostly in general education classes will receive an add-on weight that is 6 times the amount of the flat rate each student receives. However, the disability categories that contain the largest percentage of students receive the least amount of money. This category in particular that SB 1189 was written to address, this category brings in less than $19 per student per year. This number fluctuates based on the district's property taxes and location, meaning that districts that receive more funds are typically in suburban areas where property taxes are higher, leaving inner city schools with some as low as $12 per student per year. So for example, in Tempe Union High School District, the school only receives $17.32 per student per year for 76% of the special education population. This is less than $2 a month for a student with a common disability, such as developmental disability, anxiety, dyslexia, a speech and language impairment, and many, many more that can be found on the Arizona Department of Education's website. With so many children not receiving adequate funds, the schools have to take the money that they receive for the higher weighted categories and spread it across all students. This means that there is not enough money to adequately provide services to all students who have a disability. This is leaving students with all levels of needs without support that would otherwise enable them to reach their full potential. If you are curious to find out the flat rate your school receives per student, contact your district office. Weights for special education are based on the primary category listed on your IEP.
Thanks, Amanda. So I even as an education advocate, I am shocked when I hear those numbers. I think of how little anybody can do with $17. You can't even get a meal these days with $17. And these are the resources for our most precious students. So that makes me very upset. Raquel, can you give our viewers maybe a clearer sense of why we're making the case that children with special needs frequently require more funding, but that might not be obvious to everybody in the audience. Can you help me out?
Well, definitely. I mean, I think we can all pretty much see that children with special needs, they have an individualized education plan. They have specific needs. They don't fit in a box, and you can't. So you have to meet the need of every single student. Our schools must provide them with the services that they need. And those, like Amanda had said, they're not getting reimbursed for any of this. And so the services need to be provided, and yet, in an individualized way. And again, what my son needs for his learning disabilities are not what is needed if you are autistic or severely multiply handicapped, disabled. And so, it's just this trying to all kind of a thing. And it's just not working at all. And especially when we look at the funding and how each district, it will depend on their property taxes. And so, I come from a small town. One of the reasons that I have really woken up is because our smaller rural communities, have to meet the needs of these students, and they don't have these, choice academies and places that they can, we hear a lot about, school choice and going elsewhere, but our rural communities don't have these places where they can take these students. And we also know that students can show up to these choice academies, private schools, and get turned away. And so we know that our students the majority of special education students are being serviced and educated in our public schools. And these schools are not receiving the appropriate funding. And so it's just a terrible domino effect. Like Amanda said, because, we keep stealing from Peter to pay Paul, but Peter and Paul are both broke now because we've been taken for so long.
Absolutely. and for people who don't know, a lot of our special needs students, they need additional aids, sometimes 1 or 2 aids per child, sometimes services including like feeding tubes and assistance with clothing and all sorts of things that if you don't work in a school, I just think that you're just out of touch and you might not realize that. So it is very expensive and such a worthwhile investment. We're also hearing a lot about early intervention programming, and Michelle here has so much insight for us. So can you explain, like we understand that early diagnosis would be important, but can you really explain to our audience why? And then what is the programming that you're asking for and what is needed from the state?
Sure. So we all know that early intervention services lead to better outcomes for our children. They also, in terms of cost benefit analysis, if you treat a child younger, more intensely, more likely that child will not need services down the road. And so really what the state is doing is they are not adequately funding those systems of support. Every 5 years, the state has to do an audit of itself, basically, and it's called a rate rebase study. So they're trying to come up with benchmark numbers of what therapists should be paid and what the state is paying them. So this year they finalized their rate rebase study, and they found that DES and DDD are $150 million underfunded. $150 million. That is insane. There was a bill going through this year. It was SB 1355, and that was to add $30 million to that. Well, you can see that that is a very small amount of money compared to the $150 million that is actually needed to fully fund these programs. The other thing to understand is within DDD, you have two different systems, right? So you have the early intervention system, AZIP, and you have ALTEX. What a lot of people might not realize is that these are funded completely differently. What a therapist makes in early intervention is peanuts compared to what a therapist makes in Arizona long-term care. So for example, if you're a therapist in Arizona early intervention, you have not had a raise since 2015. So that means that therapists that are working with our youngest children are making about $50 less an hour than the ones that are working in the Arizona long-term care system. Okay, and so I think what our biggest worry is that even if they funded this $30 million that has to be split amongst the whole entire DDD system, Arizona early intervention could get shortchanged again because it's just a smaller piece of that entire pie. And so what we're asking for is to fully fund the $150 million and stop making us go back and beg for more money. We have the money, we have the surplus. Let's take care of the problem right now.
Absolutely. I see your beautiful child wants to make an appearance. Hi. Well, I mean, it sounds like there is a lot of funding needed. I'm doing the math on my napkin, and it sounds like the state could be, we're really asking the state for $250 million this year. And I'm hearing, in a lot of ways that that's actually a really reasonable request. It sounds like a lot, but in terms of the state budget, and like Michelle said, what we have in surplus, that is a very reasonable ask this year in particular. We know that Arizona public schools have suffered funding cuts for decades. We know that the Arizona legislature and Governor Ducey are currently negotiating the state budget, and that's the budget that funds our K-12 schools and all of these programs. And we know that the state has much more funding than was anticipated. So a bit of a windfall. And so I guess I want a little bit of information from you, Amanda. What is needed in the budget so that we can adequately serve our children, and what are you hearing down at the legislature?
Okay, so since there hasn't been a cost study done since 2007, there is not enough information to adequately state how much money is actually needed. It is estimated that we have a $100 million annual funding gap for K-12 special education services. This is per year. We need this money for quality service providers, technology, program costs, transportation, infrastructure, screening and assessment, teaching, counseling, skilled instruction, and all educational services provided to special educational students. SB 1189 was written to provide $55 million for K-12 special education funding services. It's about half of the shortfall. Now that we know that Arizona has a $1.2 billion ongoing budget surplus, legislators need to commit to full funding on an annual basis for K-12 special education. These funds would go to the district and charter schools to cover costs associated with disabilities that are not funded or are severely underfunded at the 0.003% funding formula. This is between the $12 and $17 per year student. SB 1189 also was scheduled to provide $5 million for the Extraordinary Needs Fund. Arizona's Extraordinary Needs Funds provides funding to district and charter schools to help cover some of the costs associated with educating students who require an intensive level of support. These costs can be real hard on a school's budget. To be eligible, costs must be at least 3 times the normal amount expended on a child in Arizona. Arizona's Extraordinary Needs Funds typically does not have enough funds to support the needs of district and charter schools. Extraordinary special education expenses can cost $50,000 or more for students with extreme needs who require intensive support. For example, students who are homebound with a serious medical issue. JD Mesnard stated, "We have more money than we know what to do with. It is time to fund Arizona special education."
Yes, so Senator Messner did say that a couple of weeks ago. And so it just highlights the point that obviously we have plenty of money in the state to take care of the kids who need it most. Michelle, did you have anything you wanted to add there? Raquel?
Well, what can I say? What can I add? That, my brain blows up with these numbers, especially with that extraordinary needs fund. It's not nearly adequate. There's not enough money in there. And with all the needs, as I kind of listen to all of this, it feels just like teachers are already, that we already have such a shortage of teachers, and to find teachers, special education teachers, especially, who are, we haven't even mentioned that, right? That the teachers are having to do so much more with so much less. Someone, mentioned paraprofessionals. I know that our PTO raises money in our district because we're able to pay for parapros, just so that the numbers in our classrooms are adequate. And so I taught in different states. I taught in Texas. I taught in Illinois, where they had adequate funding, where you had people coordinating the meetings, where you had people coordinating these METs, these annuals. I mean, these special education teachers have to coordinate all of this. They have to run these meetings. They have to staff these meetings. That's after they write the IEP. That's after they've worked all day. So, I don't know how much more we can put on these educators and these administrators. And it just seems like they keep piling on and until it breaks. And so all I can say is, the money is there. It's raining now. The rain is coming down. It's monsoon time on our education system. And so definitely we need to, work together to make sure that they hear us down at the legislature, the governor and the legislature, to say, we know you have the money, and you talk about how important students are and mental health and all of these other things. So why don't you put your money where your mouth is and actually fund this system?
I mean, I work with obviously all of the special education teachers as a classroom teacher, and I see that, Raquel. I see the hours that they work, and that sort of comparison with other states was fascinating to me, because I've only taught in Arizona, and I actually thought that's just how it was. Honestly, until you just said that, I thought all special education teachers were responsible for all of that.
When I arrived in Arizona, that working condition, it literally catapulted me out of special education. I bounced immediately. I moved here from Texas, and I went to work for Paradise Valley School District, where I took over for a communication disorders class, where they had different students of different needs. And I finished off the year for them and immediately was like, I'm done. And had my children right about then. So it was a good way to say, like, I'm going to go raise my kids. I can't do this. So I was able to do that. But when I came back, when my kids went to kindergarten, it had just gotten worse. And so I almost want to, kiss the teachers that come to work every day, but special education teachers, woof, I want to wrap them in a little extra bubble wrap, because they have so much on their plate, and it's becoming an unsustainable situation.
And they're also acting as counselors and psychologists and social workers and nurses every single day, because we also don't fund those programs. So I heard you say, Michelle, that Amanda, that a cost study has not been conducted since 2007, which was 14 years ago. I know that Ducey's Classrooms First initiative in 2015 found incredible deficits in special education funding. And that was a 2-year study, and nothing has been done based on those recommendations. So I guess my question to you is, with your crystal ball, when we can achieve this cost study, what is going to be found and how far, like what's the number? How far do you think we are behind the actual funding that we need for special education and for early intervention?
So that number will be pretty difficult until we can actually get a cost study, because the cost study was so long ago, and with cost of living and everything, that's just a very hard number. But what we do know is that a cost study is needed to determine this gap between the actual cost of special education services provided by district and charter schools and the funding that they receive from the state and local sources. The last cost study that was conducted 14 years ago in 2007 was so the gap between what is spent and what is funded has been growing, obviously, because of cost of living and life. Cost studies need to be reinstated every 2 years, which is what we are asking for, to look at what it is costing to provide these services to students based on their diagnosis, so the state can adjust it in their funding weights. A regular scheduled cost study is critical to make sure that schools are reimbursed for the expenses associated with ensuring that students get the special education services that they are entitled to. A regular cost study is the best way to ensure that Arizona never has such a large funding gap in special education services again. It must be mandated by the legislator to ensure that it happens. Such a mandate would reflect legislators' commitment to infants and children with disabilities. Because currently in Arizona, in 2019, there were almost 150,000 students, or 13% of students in Arizona, that had disabilities. Prevalence is 14% of those students receive special education services. 1 in 3 students have a specific learning disability. 1 in 5 students have speech and language disorders, and 1 in 7 students have other health impairments, which are all covered under that 0.003% funding weight.
That's the $17.
That's between 12 and 17, yeah, $12 and $19, depending on your rural, inner city, or suburban. So Tempe Union is at $17.32.
All right. Well, I think it's pretty obvious for anybody who's tuned in for this conversation that this funding is incredibly critical. We need it now. I want to hear from Michelle a little bit about this push from your group, and why is it important for all of us watching and all of Arizona to take action and try and pressure lawmakers to make sure that this actually happens now and not later?
Well, this year we have this budget windfall, right? And they're estimating it to be happening year after year after year. And what Amanda really drove home is that these shortfalls that we're talking about today, they're not a one-time, one fix. We're going to throw $250 million at it and everything's going to be fine. This is a yearly shortfall of $250 million. And if we're seeing that we're going to be able to cover that year after year after year based on the projections that they're looking at right now, then we really should do it and we should take care of it. The other thing that makes this really precedent right now is we have kind of never had a good beat on how the legislature has felt about people with disabilities, right? And this year, they really went out there and they kind of put their mark and their little foot in the sand, and they have told us where they stand when it comes to people with disabilities. This year, they passed SB 1457. Now, this means that people who are pregnant, and if they find out that their child has a genetic disability, they cannot abort that child. So Governor Ducey went out and said, there's a measurable value in every single life. So if you think that preborn children are valued, then you also have to think that those born with disabilities are also valued. And you have to fund the programs that help those people become independent adults. That's what we're asking for. We're asking you to back up and support what you have just told us are your values.
Thank you. That's so powerful. And I mean, I think it's just, it's a no-brainer and there are no excuses. And it sounds as though this ongoing surplus, the word ongoing lets me know that it's possible to commit to making that sustained investment, not just this year, but every single year, to put that in the budget and keep it going forward. Many of you know that Arizona is still funded 50th in the nation for K-12 education, and we know that our students who need services are impacted the most by those cuts, and it's not fair, it's not okay. Many of us have been advocating for years and we haven't seen the results that we need to see. And I know as parents, we're starting to say, you know, when is this ever going to happen? You know, my kids, when we started advocating, were 3 and 4, and now they're 8 and 9. And I start to wonder if they'll ever be in a fully funded system. And I know all of the parents watching and these amazing ladies here are thinking the same thing. Is my kid ever going to get what he or she actually needs from the state with my taxpayer dollars? And I know it's very frustrating. It's easy to get I don't know, it's easy to get your head down about all of this and feel like things will never change, but I don't believe that. I think that if all of us join together and fight for this, I do think that the legislature will move the needle on this, because I truly think that Arizonans really care about our special needs students. I truly do, for all of the reasons that we put forth today. So Kate is putting the link to the amazing petition that you all have developed, I think today, right? It's like brand new. So
I think it came out yesterday, yeah.
awesome. So hopefully we can get some more signatures. Amanda, is there any sort of like parting word? We don't have, there's a lot of support in the chat. I don't see any exact questions that are like group questions. So I'd love to take the time to give you parting words of advice or wisdom.
Perfect. Well, right now is the time to act. Right now it is the time to gather Arizona together in a full-on call to action for funding special education. You guys can follow us. You can sign the petition that was just posted, but you can follow us on hashtag FundAZSped. We are on Twitter, we are on Instagram, and we are on Facebook in a Facebook group. We are posting action items and we are looking for your stories, because faces will tell the state what is missing. So share your stories with us, share your early intervention stories, your public education stories, so that we can really just let the legislators know that the state is requesting this. A group of parents can make a wave, but together we can do this.
Absolutely. Michelle?
Now, I just want to second what Amanda said. And really, it's about us all coming together. It doesn't matter what disability your child has. It doesn't matter if your child has a disability, to be honest with you. We should all care about building an inclusive community where every single child has the option and the opportunity to thrive. And that's what we're talking about here. We're talking about funding programs that help people live full, productive, happy, healthy lives. And every single person, regardless if you have a child with a disability or not, should care about that. And so we are just hoping that we're getting people engaged from the disability community, but also outside of it, because everybody should care about the community as a whole and getting more people to actively participate in it. And I just want to thank you for having us on here today and for giving us a platform to really talk about these issues. So thank you.
No, truly, thank you. You ladies are so amazing. Raquel, do you want to leave us with final parting words? Maybe some
Sure. Absolutely. Well, you know, what keeps me going is realizing that my children are 7th graders and they have not been in a fully funded system their entire school career. And so besides, you know, yes, special education, like Michelle said, is important, but our education system as a whole is important. And it really should not matter whether you have children or not and where your children go to school. It should matter that we as a state, we know that our Arizona citizens value education. They've told us time and time again, and they've showed us time and time again that they value education. And our legislators, you know, need to listen to the will of the voters and what the voters want. And so it's in our Constitution. Arizona Constitution, you know, says that these systems should be funded. And so I think, like Amanda and Michelle said, you know, together we can make a tidal wave. You know, we've been making ripples, but together, thank you to Save Our Schools for continuing to amplify voices and give us the tools to call and write and email. And I think they're sort of counting on us getting tired and going away, but we're not. We are coordinating, we are galvanizing with other groups, and we are meeting other people. I just met 2 fabulous new advocates tonight. And so I just want to say, tune in, do whatever you can. Every little bit counts. A phone call, an email, every bit counts. So sign that petition. I definitely am going to share it as well. And let's, keep it going until we get what is the right thing for our kids.
Absolutely. Absolutely. I love how you added that you don't have to have a student in the public education system to even care. I have a 7-year senior, meaning he is on his 7th year of high school. He actually just had one of his first graduations today, and he's on his last year of school next year. And I have grown in the process and learned everything that went wrong, which, like I said, and I know it all leads down to funding, and I may not be able to help my son's educational experience, but what I can do is let this cycle stop here by fully funding special education, early intervention services. If you do, you will create adults that are more functioning, more capable, and more independent for this world, which will cost less of a strain on so many areas, from homelessness to drug abuse to mental health, because they were given the tools and the supports to help them succeed and become something in this world. Fund special education.
Absolutely. Well, I think we've only scratched the surface, and I definitely don't think that we've heard our last from you all. And I'm so excited to hear and learn so much more from you. Please fill out the petition and share it on your own social media. I know Kate's dropping that in the links on Facebook. Please share this event. I think there was just such a wealth of information, and if you can share these amazing advocates and their voices, I think we'll all be better for it. So stay tuned. Please email those lawmakers, call Governor Ducey, and just ask for special education funding for Arizona. It's not a hard ask, and it makes all the sense in the world. So thank you so much for tuning in, and stay tuned and stay fighting for Arizona kids. Thank you, everybody.
Thank you.
Thank
Thank you
you.
for having us.